patients present with symptoms, and symptoms are what we really treat in the beginning. For me to take an hour for an evaluation and try to figure out exactly what's going on is actually pretty unrealistic. On average, as I tell all my patients, I will give you a diagnosis at the end of this session, which will be a working diagnosis. We live in a world of insurances, and insurances require a diagnosis for us to be reimbursed for the time we spend with our patients. However, in our medical school training, we have what we call a rule out, which means we have a differential diagnosis of X, Y, and Z, and we try to figure out, we think it's this, but it could be that, or it could be something else. In many cases, most patients have multiple diagnoses. I'm envious of my internal medicine friends. You come in, doc, I've got a sore throat. All right, I swab your throat. I send it off to the lab. I know it's beta strep. The lab also tells me what antibiotic is going to be effective. I wish psychiatry was as easy. The doctor sees you, gets a family history, a social history. They do a mental status examination. We take what we call a review of systems, so we know all about your medical condition. The family history is extremely important, so that when I see a patient and I feel, all right, they may have major depressive disorder and generalized anxiety disorder, and I'm going to treat them with an SSRI, which is a serotonin reuptake inhibitor, and I may be treating them with a short-term benzodiazepine to help them get through that anxiety, because we know these medications take, on average, 10 to 14 days to get into the system, and then another 2 weeks to 4 weeks to really be effective. I am Dr. James Smith. I'm the Medical Director of Carolina Partners in Mental Health Care, and I want you to be well.